Hi, everyone, and welcome to tonight's special webinar. My guest tonight is Deanna Hansen, and actually I put that it was 10 years ago, but I think it was actually 12 years ago that we met, and at a Nature Sunshine conference in Canada. And Deanna had some really interesting ideas that I wanted to learn about. She did some massage on my abdomen and got up and had to notch up my belt a couple of notches because I was like 2 inches thinner around my waist after an hour. And she did a massage on my neck and everything that made me look 10 years younger and taught me a lot about posture. And we co-authored a little course called Love Your Body Beautiful. Lost touch with her for a while, but we got in contact again, and she's been further developing her ideas and concepts. And so I thought we could have a webinar and let her share with you what she's been working on and some of her ideas, which I have found to be very, very helpful for me. So Deanna, take it away.
Thank you so much, Stephen. And, likewise, I am so excited to have reconnected with you. I think both of us are on the same page. We really want to help people heal. And for me, teaching people how to self-care is really my passion. So I just want to share a little bit of my story with people. So in my 20s, I was studying to be an athletic therapist. And at the time, I was 50 pounds overweight, struggling with anxiety, depression, struggling with addiction, and I was working really hard to try and change things, to try and change the shape of my body and the size of my body, but all of my efforts were actually making me bigger. I was accumulating more pain. I was struggling with anxiety more all the time, and so even though I was really working on dieting and exercising more, my body was getting larger, which didn't make sense, which actually ramped up my anxiety and my depression. So at the age of 30, I made the decision to quit drinking, which was, a wonderful thing to do. But what happened from that was my anxiety attacks started ramping up. Suddenly I'm having to live my life soberly and deal with all of the consequences of the unconscious choices that I made. And so this one day in particular, I was having an extreme anxiety attack. And for some reason, I dove my hand into my belly. And that moment changed my life forever. The first thing that I experienced was pain, but the pain was calming, and it actually brought me out of my anxiety attack. So I knew I was okay and I was safe in that moment. But I also recognized that my tissue was marbled like scar tissue. So as an athletic therapist, I was a deep tissue worker, and I was very familiar with scar tissue from injury or surgery, but yet I hadn't had any injury or surgeries in my abdomen. So suddenly I'm realizing, no wonder when I'm coming home from a 5-mile run dripping wet with sweat, my belly is still cold. And no wonder I'm not able to lose any of that size. So, for the first night, I probably explored in the tissue for about 45 minutes or so. And, the whole time I was feeling calm, and it was just such a change for me. So I woke up the next day a little tender, but all day long I was calm, and I was really excited to go back and to explore a little further. And after the second time of spending, again, about 45 minutes exploring in my belly, when I stood up, I felt taller. And when I went to the mirror, I literally started to cry because my abdomen was flatter than it had looked in years. And this started a journey. It was 16 years ago that this whole process began for me. So initially, I started working on my patients in the same manner that I was working on my own body. I started flipping my patients onto their back, and I started working in their bodies. And that was really awesome. But along the way, other therapists were being attracted to my work because I was having these really incredible changes in people's bodies. So I started teaching therapists my technique, Fluid Isometrics. But for me, my real passion was teaching people how to self-care. I learned this on my own body with my hands, and I wanted to find a way to transfer that knowledge so people could do this also for themselves. So there was a time when I was trying to teach people how to use their hands in their own tissue, but that was proving to be too challenging. So this was about 7 or 8 years ago, block therapy began to organically evolve as a way for me to teach people how to do what I was doing on myself and in the treatment room, to teach people how to do it on themselves. So that was a really amazing moment for me when I realized that, wow, people can literally use their body weight and gravity to really do the same work that I was doing in that treatment room. And that was just an incredible opportunity for me to develop a program that we could really share with people all over the world. And what I really learned as the basis of everything is that it all comes down to how we breathe. So if you can just notice here, the diaphragm is moving up and down in the body. I'd like everybody listening to just put your hands on your lower ribs. This is where the diaphragm muscle lives. Now, the challenge is that very few people are actually breathing with this muscle. Most people are breathing from the muscles of the upper chest. And that's because over time, our body literally collapses due to gravity. So the rib cage falls into the core from unconscious posture and breathing, and it blocks the diaphragm's ability to work properly. So now if you notice this, the diaphragm muscle in this picture, so just below the lungs and the heart, just above the liver and the stomach, this is the diaphragm muscle. It's a plate. So now again, we just saw it moving up and down in the body. When it's working properly, there's a mechanical action that is going on, creating a heating of all of that tissue. So when we don't use that muscle to breathe properly, what is happening is the entire weight of the rib cage is collapsing into the core, displacing the organs, and now we don't have that mechanical action of the diaphragm taking place, so the tissue starts becoming colder. And blood flow travels through the body because the tissue is a certain temperature. As our tissue starts to become frozen, blood flow slows down. So now your cells aren't getting properly fed and clean, and issues start to arise. So some very common issues resulting from incorrect posture and breathing are issues with size and shape, chronic pain, fatty liver disease, poor digestion and elimination, and anxiety and depression. So issues with size and shape. This one I am very, very close to because I was, again, 50 pounds overweight. And I was doing all of the things that I thought I should be doing. I was working out. I was decreasing my caloric intake, yet my body was getting bigger. So what I've learned now is that when we aren't breathing properly and using our body correctly, we are actually displacing our tissue. So when the rib cage falls into the core, the belly extends outward, and that affects the size. And not to mention, when we aren't breathing properly, we're not digesting food properly, we're not eliminating properly, so we get a backup of waste, which attracts parasites, and they create waste. So what I've really come to realize is weight loss is really different in concept than what we are led to believe. We need to decompress the body and detoxify the tissue if we want to bring our size and shape back to its correct alignment. And really it does come down to cellular alignment. When our cells are being displaced and pushed and squeezed, they're under pressure. And just like a balloon under pressure, and I've got a slide to show you that later, there's a ballooning effect. So typically as we get older, we get shorter and wider. And we feel that it's harder to lose weight as we get older. But it's not about fat loss. It's about displaced fascia and the tissue becoming toxic, which causes an expansion of the cells. So when we're doing block therapy, we're literally putting the body back to its correct alignments and then accessing proper diaphragmatic breathing. And again, we're going to touch a little bit more on that in a short while. The next thing is chronic pain. So I love this picture because this so well demonstrates what is very typical in our understanding. So many people have pain in their back, but if you notice where this man's left hand is, that's the cause site for where the pain is. And so as a therapist, I was trained to work on the pain site, but we need to understand the cause sites of pain in the body. And typically we age in a forward rotational direction. So if we just go and we work where it hurts, we're not really affecting where the cause of the pain is. So with block therapy, we are approaching the body from the cause site so that we can release the tissue holding us out of alignment, taking the tension off the tissue that's really feeling the pain in the body. Now, fatty liver disease, this is really interesting because this is on the rise. And if you notice again where the liver is, it is right below where that diaphragm muscle is. So if we're breathing properly, we are constantly heating the liver through that mechanical action of breathing. But very few people are breathing properly. So what happens is the liver's becoming cold. Now, if you have butter at room temperature, it's a solid. When you heat it up, it becomes a liquid. So because so many people are collapsing at a faster rate, we're sitting in front of a computer all day, we're not active. The youth today in particular, they are collapsing at a very fast rate because they're growing up with technology, as opposed to, Stephen, you're in my generation where technology came as we were kind of approaching, adult age. So what we need to do is we need to create that heating effect so that we can melt those fats that are blocking the liver from doing all of the many jobs that are necessary for a healthy liver. Poor digestion and elimination. Again, we talked about this already. When the rib cage collapses into the core, it puts direct stress on the stomach organ. We're not, again, working that diaphragm muscle to keep that stomach organ heated. So now we're not digesting our food properly, and it's causing problems. We're not eliminating properly, it's causing problems. And what's interesting too is if you look at pictures of anatomy, those are of the perfectly aligned body. Nobody is perfectly aligned. We're going to be touching on posture very shortly. What we need to do is we need to understand that in order to have perfectly working systems, our cells need to be in their correct alignment. And the reality is because we aren't balanced and we aren't symmetrical, our bodies have compressed over time, and that compression is causing problems for us. And then anxiety and depression. This entire process started for me from an anxiety attack. And what I've really come to understand is when we sense or feel something, it's because that's what our cells are telling us. So, we have approximately 100 trillion cells that make up the body. Each and every cell, first and foremost, requires oxygen to thrive. When we're breathing through the muscles of the upper chest, we're literally starving our body of oxygen. I read that when we breathe diaphragmatically, we feed the body up to 600% more oxygen than when we're breathing through the muscles of the upper chest, yet very few people are using that diaphragm muscle. So the cells are anxious because they're being asked to do their jobs, but we're not feeding them properly. So that's something that is very dear to my heart because I used to suffer from serious depression and anxiety, and this whole process has really changed that for me. So now the challenge that we face is injury, surgery, and unconscious posture. These are the things in the tissue that create a block or a barricade to blood and oxygen flow. So if we've had surgery, we all know what that's like. We know that we have a mechanical scar that's being actually put into our tissue. Same with an injury, whether it's a tear in your soft tissue or a break, the body, in the way that we have learned, heals with scar tissue. Now, what's really interesting is with unconscious posture, over time, when we collapse out of alignment, that tissue acts like scar tissue. It acts as a barricade to blood and oxygen flow just as strongly as scar tissue from injury or surgery. So these are the three things that we're challenged with in the body that we want to overcome. Now, if we look at these two bodies here, the before and after pictures of posture, if we look at that, in the man here, the right alignment, imagine where the diaphragm is. If it's moving up and down properly in the body, there's the space for that to happen. If we look over on the left with the man out of alignment, imagine that break there where the diaphragm muscle would be. Now the container for the diaphragm to move properly has been affected. So the movement of that muscle is going to be compromised. And therefore, it's not going to work to our benefit. And again, 600% more oxygen when we breathe diaphragmatically. People are talking about nutrients and superfoods and all the other things that are wonderful that we need, but very few people are focusing on how significant oxygen is for our health. The brain will die in 5 minutes without it, and every single cell in the body is like that too. If we're not feeding our cells optimally with oxygen, they're going to slowly go through the process of shutting down, which is really what age is. Another thing, we're dominant on one side of the body. So typically, we don't only collapse in a forward direction, we also rotate out of alignment. And this is a very common right-handed posture. Now, of course, this is a typical individual with their posture where we actually shift our weight to our less dominant side to keep that dominant side free for action. And if you notice on the right-hand side, where the liver would be, there's less space on that side because of that mechanical shifting. So that in itself is causing pressure, compression, a lack of blood flow, and it's going to affect the health of the tissue. So here's me simply standing before and after. So this is something that's really important to note, because I don't want to look like the picture on the left. I don't want to look like I have a belly and hanging breasts. I would rather look like I have a flatter belly and breast tissue that's supported with the proper foundation. So again, the challenge is that we're dealing with the fascia, the connective tissue. What is so important to understand is the connective tissue can seal our body out of alignment with a force of up to 2,000 pounds per square inch. So again, we have approximately 100 trillion cells in the body, and each cell has a container in order to keep it protected. So the goal is that we align every cell perfectly in the body, but because of injury, surgery, and unconscious posture, we are falling out of alignment, and that is really affecting us, because again, all of those areas of scar tissue are creating blocks to blood and oxygen flow. And just like this beaver dam here, if there's blocks to flow, the flow is minimized. So if we're doing something like exercise and we're asking our cells to work for us on our behalf, yet we're not feeding those cells what they require, we first experience pain. And then if we ignore that pain or we mask that pain, eventually we're going to end up with some real problems and tissue damage that we're going to have to deal with later. So imagine here the circulatory system. Let's look at that picture where the arrow is in the armpit. This is the brachial artery and vein supplying the arm. In the legs here, that lower picture, those are the femoral artery and veins supplying the leg. When we are not standing properly, or we have shifted our weight to one side, we are creating mechanical barricades to those roadways for blood and oxygen flow. And that's true of everywhere in the body. We can't see the picture very well here, but the aorta, the main artery leaving the heart, is right underneath the heart, right where the diaphragm muscle lives. So when we collapse into the body due to unconscious posture, we're literally strangling that straw, that roadway of blood flow leaving the heart, which is going to compromise the heart muscle. It's going to have to work harder to try to pump blood to all of the cells in the body. Even now, look at the nervous system, the same thing. If a nerve gets impinged, or piriformis syndrome, or the sciatic nerve, if those get impinged, we can have nerve pain running down the arm and the hand or down into the leg, or we can have pain anywhere in the body from a nerve impingement. But really, it's the roadway that we have to be aware of. We want to keep those roadways open so those systems are working on our behalf. Even the lymphatic system, 70 to 80% of immune function resides deep within the belly. So as we collapse over time with our unconscious posture, we're blocking the immune system from getting properly fed with blood and oxygen flow. So now that system is going to be compromised from working on our behalf. So really, it's understanding that our posture and our breathing is really key to lifelong health and well-being. And if we don't have it, it leads to pain, aging, and disease. This is something that doesn't have to happen, though. This is something that we accept as a normal consequence of living a long life, but it's not something that we have to allow. So let's talk about pain for a moment. There's a pain-fear cycle. So we have this idea that pain is a bad thing, but really pain is a language that the body uses to let us know that the cells need something. It's like the baby crying. If your baby was crying, you're not going to mask it or throw it in the corner and ignore it. You're going to pick it up and you're going to love it. You're going to feed it or change it, or whatever that baby needs in the moment, you're going to give it. Now, your cells are like your children. If your cells are shooting pain, it's because there's compression. It's because they're hungry. It's because they're exhausted. It's because we're not treating our cells with love and affection, and we're trying to force them to do things without any realization of the consequence that we're creating by mistreating them. And there's a pain-fear cycle. So once we experience pain and we don't actually understand what the pain is for, we hold our breath, because that's our natural response to pain. Pain, fear, and stress cause us to naturally, reactively hold the breath. When we do, that brings out fear. When there's added fear, there's less breath, there's less oxygen, there's more pain, and we get caught in this pain-fear cycle. So with block therapy, what is really great is we teach people that pain is our friend. It is the language that our body uses to give us information. So with block therapy, it's all about moving into the pain in your tissue, because that is the roadway back to balance. We basically want to unzip the tissue at the seams of time so we can make it younger. We can pull the pain out, putting the space back, taking the time out, and making the tissue alive and youthful again. It basically becomes rejuvenated. And again, it's also understanding that where there's pain, that's not where the issue is. There's a cause site to that pain. Just like this balloon here. If I'm squeezing a balloon, there's where it's under pressure isn't where I'm squeezing it, yet where it's under pressure is where we would be feeling pain in the body. So in order to change that, we would release the grip of the balloon to find balance in that balloon. So, for example, if we have back pain, just like in this picture back here, if I go and I massage this guy's back, all I'm doing is sending blood flow in the moment to the tissue to give temporary relief. If we want to find permanent relief, we need to address that cause site, we need to oxygenate that area, and we need to rebalance the body with proper postural foundations and understanding. So I'm just going to share a testimonial with you. This is a wonderful woman that I met and who did my block therapy retreat. So this is Dr. Julia Bolin.
Hi, I'm Dr. Julia Bolin, physician, author, and founder of Personal Awareness Medicine, and I'm here in beautiful Aruba on vacation and conference. And I want to tell you, sometimes when you sleep in other beds, your back does not feel very good. I'm going to tell you, the other day I woke up and I was frozen. My back was stiff and I was in pain. And as a physician, after 20 years of medical practice, the first thing that I tend to grab onto is Tylenol and ibuprofen. Those are the things that I naturally, as a physician, want to gravitate towards. But you know what? Since I found Deanna Hansen's block therapy, that is the one thing now that I crave when I start to hurt. As a gymnast, many years back, I abused my back, all those back bends and all those arches. And I'm going to tell you, as a physician, when I treat back pain, I think about prevention of back pain, maintenance of back pain, and how to keep it from coming back. And Deanna Hansen's block therapy does all that. It breaks into tissue, gets deep into there, deeper, much deeper than even massage therapy can do. If you want your back to feel better, to prevent pain, and to treat acute back pain, get into Deanna Hansen's block therapy. She's there for you, and she's going to teach you how to take care of that long-lasting chronic back pain. Deanna Hansen, block therapy, that's the answer for me.
So that was Dr. Julia Bolin, and I had the honor of spending 3 days doing a retreat with her, and since then we've become really great friends, and we're going to be doing lots of work together as well. So with block therapy, we do 3 things. We create the space that we've lost over time. So all of that compression that I was talking about with unconscious posture that gets created, the scar tissue from injury or surgery, that takes away space. So with block therapy, we create the space. With the proper instruction of diaphragmatic breathing, we inflate that space. And again, remember, diaphragmatic breathing feeds the body up to 600% more oxygen. So I want you to think of a balloon. Again, we saw some balloons before. When we have a balloon that's fully blown up, it almost defies gravity. When the balloon has no air in it, it falls to the earth very quickly, and it becomes heavy because there's nothing in it to keep it nice and light. The same thing happens to the body when we're not breathing diaphragmatically. Our cells become deoxygenated, they become heavy, we create compression, and ultimately we are lumbering through life, creating injury, creating a lack of joint space, which creates things like arthritis. It creates lots of problems. So we create the space, proper diaphragmatic breathing inflates the space. And I don't know if any of you know who David Wolf is, but I've had the opportunity of working on David a couple of times, and this is what David had to say about block therapy.
Greetings, everybody. This is David Avocado Wolf, and I had a treatment today with Deanna Hansen, and it was amazing. I've been working on an old injury since 1989. It really took me 16 years to kind of get through it, and I've been expanding my chest and opening up my rib cage, but today was really a pioneer moment. opened up everything. It was really special, and I actually felt like I got taller. My ribs came in, my stomach got flatter, and it was just amazing. I've been doing a lot of physical fitness recently too, a lot more than I've done in 25 years. And to have this work done on my body right now, incredible, felt so good. So I just want to give Deanna Hansen a big thumbs up. She knows what she's doing. She's an expert in getting into your tissue, opening up that rib cage, opening up the stomach, opening up all those fibers so you can breathe deeper, enjoy life more, have less sore muscles, and of course have the best day ever.
Oops. So,
Greetings, everyone.
there we go. And then the third thing that block therapy does is it maintains the space. So now we've created the space, we've inflated that space, and now we don't want to go back and fall right back out of alignment and have that magnetic seal hold us and keep us bound. We want to maintain our space with understanding of proper foundations to stabilize and support the cellular alignment. So through my programs, I teach people how to systematically create the proper alignment in the body. And what's very interesting is the tongue muscle. So the head, for example, it weighs about 10 pounds. However, when it's not correctly aligned, it can apply up to 100 pounds of force on the muscles of the upper back and the neck. Now, what I've learned over time is the tongue muscle, in part, is designed to support the weight of the head, but people aren't using this muscle for this purpose. So instead, it becomes a hindrance, forcing the neck to come forward. And in the front of the throat, where the tongue muscle resides, we have our thyroid gland, we have the major lymphatic drainage sites, we have the carotid arteries supplying the blood flow to the brain, the face, the eyes, the hair, everything up that chain. And so part of the education in block therapy is integrating these proper actions to support our structure and cellular alignment. This is one of our instructors, Rachel, who's a massage therapist and yoga instructor, and this is what she had to say about block therapy.
Hi, I'm Rachel Aberley. I'm a massage therapist and a yoga instructor. And for the past 15 years, I've been searching high and low for the right tool to help people reach their full potential and really get down deep to the root of the problem that they've come to me with. And I've just discovered the block therapy workshop by Deanna Hansen. And I feel like I don't need to search anymore. This is what I need to really help people reach their full potential and come into their own space, come to their awareness, and really feel strong and supported. And I'm really looking forward to helping people further and helping myself.
So what we have is a program called the 21-Day Block Blitz. And in this program, you get the Block Buddy shipped, as well as the intro video series, Freedom is Only a Block Away, which has 3 45-minute videos on it, one for the core, one for the pelvis and legs, one for the head, neck, and arms. And then we have my 21-day program, which this is key because it's all about creating the day-to-day proper habit. So I created this program because what I've learned over time is it's wonderful doing an hour class once a week, but it's the 15-minute per day, everyday action that is the key to transforming your life. So in this 21-day program, I show you how to optimize by cycling through the 21 days combined with that other video so that we can really learn how to get the block into the tissue through the whole body, and every single day continue to melt through the restrictions that are sealing our body out of alignment and really strengthen the diaphragm muscle. And this is Kathy, my friend. I put her through the ringer because I wanted a test subject. I wanted to prove my theory that all you do 15 minutes a day, this is what's going to happen. And in 2 cycles of 21 days, this is what changed in her body. 5.75 inches in her waist. She did nothing else with the exception of in the second round of 21 days, I told her to do a cleanse. I told her to do the holy tea. So she's actually in the book, tracked her progress, and shared her experience along the way so people can follow along with her. She lost 4.5 inches under her armpit and 2.75 inches in her hips. 13 inches in just 42 days of 15 minutes per day. And what's really interesting, this isn't about weight loss. It isn't about the number on the scale. It is about putting your body back to where it's supposed to be so we can access the diaphragm, we can feed the organs, we can digest our food, we can eliminate waste so that the body is a highly efficient organism. That's the whole point here. This isn't about one thing, whether it's chronic pain or fatty liver disease. This is really about understanding in its entirety what our body needs to thrive. So all of these things are side effects, whether it's weight loss, reduction in pain, getting control of your emotions. Those are all side effects to the fact that with the block, you're connecting to yourself. With each day that you do the block, you're moving deeper and deeper into your tissue. You are connecting more deeply to cells that you haven't been conscious of most of your life, and you're awakening your intuition. You are the best person to tell you what your body needs, but we've lost that connection to the information that our cells are giving us. So as you continue with block therapy, you start to hear what your cells are telling you, and you start to respond more positively to what your body's saying and to what its needs are. And you know, for me, people always said, you know, you must have dieted in order to lose your size. And the reality was I dieted before, and the dieting didn't work for me. Now, there's no question that over the years I have changed my diet, but not because I wanted to, because suddenly, when I say that, not because in my mind I said I need to stop eating this. It was because suddenly my body didn't want it. You know, it took me a while to realize that I don't digest beef very well. So I eat beef in a very limited way. But we just become more attuned to what our cells are telling us and to what they need. And when we learn to listen to our cells and our body and to realize that pain is actually our friend, everything changes. So with this 21-day program, all of that is included for only $247. And after you cycle through one series of 21 days, we have one of our 2 block therapists connect with you to make sure that your needs are being met. If you have any concerns, any questions, if there's any of the positions that you're really struggling with, they're there to help guide you along the way to make sure that you're feeling safe and supported on your journey. So this is really an incredible program, and in itself, this will change your life. The contraindications for this are if you have a surgical mesh. Now, I put that as a contraindication because when I started this process, I hadn't actually worked with anybody with a surgical mesh. And in my thinking, because we're creating such a shift and a change in our cellular alignment, I thought that that might be a problem. Now, along the way, many people have done block therapy that do have a surgical mesh, and they have not had any issues. But what we generally tell people to do is to work around it just so that you're not directly on it. And then if you feel safe to do so, it's all about your breathing. And the instruction is done really well in the videos that you get in the Freedom is Only a Block Away. We teach you that your breath is your guide. As long as you're breathing, you're feeding and healing your cells. If something hurts or doesn't feel right, which is affecting your breathing, that is how we know that it's not something that we should be doing in that moment. So it really is about learning from your breath what is safe to do and what isn't to do. Pregnancy, there's lots of positions in block therapy that you can do if you're pregnant, but certainly not directly on the belly, so that would be a contraindication. For people that have spinal fusion, if you only have 2 vertebrae that are fused, not a problem, but we've worked with some people that have had 4 or 5 that are fused, and they, you know, ultimately they don't have the capacity to get their range of motion back because they're being mechanically sealed in a negative or in that alignment. So that would be a contraindication. And then advanced osteoporosis. Now, we do have another program, the Whole Health Program, which is much more involved. And it includes a block buddy, a block baby, the Master Your Health program, which is the base program of information that I refer to through the whole year. This is a year-long program. It includes the 21-day program, 26 lessons with me, and a private health coach through the course of a whole year. For people that, you know, have a lot of health concerns and they want something that's going to change their life and be handheld through the course of a year, this is another program. So if that's something that you're interested in, you can certainly go to my website and take a look at that, blocktherapywholehealth.com, and that'll be on the last slide for everybody to see. And we also have a teacher training program. We're very excited because we're getting teachers, you know, we have some in the Bahamas, we have some in the States, we have a lot in Canada, and ultimately people from all over the world are asking if we have teachers to teach block therapy in their communities. So we are wanting to bring this to the world through the teachers, and we're actually upgrading our teacher training program. So if anybody is interested in that, they can just contact us at info@Fluid Isometrics to get more information from us. So these are the programs. Block Therapy Whole Health, that is, again, it's a year-long program. You can also just do phase 1 of that program, and it's all laid out for you on the website to see what it involves. The 21-day blockblitz.com, if you're new to block therapy, you've never heard of it, this is the place to start, because it's just incredible. You're going to see results right away. It's highly efficient, and you're just going to know. You're going to know that this is what your body needs. In fact, I was just speaking to a woman today that was just sharing her experience on it. I mean, this happens to me every day because people are coming to this and they're like, wow, I can't believe my body feels so open. And it's because we're releasing those restrictions that are blocking blood and oxygen flow. And when the body becomes free to absorb oxygen and to move in ranges of motion that it hasn't had for years, it's amazing what people tell us. It's changed their lives, and they're so grateful. And again, if you have any questions, you can contact us anytime at info@fluidisometrics.com. So, Stephen, that's basically what I have to share. Does anybody have any questions, or would you like to say anything?
Yeah, well, I'd like to say a few things. There are a couple of questions, and people, if you've got other people have questions, go ahead and type them in right now. I got the block, and I didn't have much chance to do it before I went to the Nature Sunshine USA convention last week, and I didn't have room in my luggage to pack it with me. So, but I could definitely tell, even with the few days that I did it, that it was, you know, making a difference in terms of helping the tissue to feel better and work better. And what I'd learned from you before has been really, really helpful to me. I mean, just I've always known that diaphragmatic breathing was important, that oxygen is the number one nutrient that our bodies need. But when I had gotten to where I could take a deep breath that was like a count of 10 in and out. And then when I met you, you just taught me a couple of simple things, and I was actually able within a week or two to get up where I could actually do almost 30 counts in and out, just from a few simple shifts. And even while I was at the convention for Nature Sunshine, I got some pain in the back of my neck from probably sitting on the plane or sleeping on a strange bed. And, you know, and typically what we want to do is people sit there and rub the back of their neck. Well, I know from you, I was working on the front. Because
nice.
And so I actually, this is something that that I learned from you a long time ago. When I'm working with people, I realize that the place that's causing the pain isn't necessarily where the pain is being felt. And I've learned a lot about body alignment and things from you, and I know I need to work on my own body a little bit more. So I'm looking forward to working on the program. But I think this is really, really important because, like you said, the tissue has to be in proper alignment in order to function properly. And as we fall farther and farther out of alignment, our health suffers as a result. And you definitely have made me more aware of my body and posture and so forth. So I think it's really, really amazing information. I just wanted to also make a comment. Did you know that there's evidence that the fascia also are another electrical system in the body besides the nervous system? They're an analog messaging system, and that acupuncture points probably influence the flow of energy through the fascia. It's just as interesting. Yeah.
And one thing I wanted to touch on, Stephen, when you were referring to your neck pain, we don't realize that the rib cage is literally the foundation for the neck and for the shoulders. So we've done a lot of work with people with frozen shoulder, for example. And when people have frozen shoulder, people typically work on the shoulder. But I've learned that it is the lower ribs that are the cause site, holding the upper body in this negative alignment, which affects the alignment of the shoulder joint. So we really do have to look at the body as a whole in order to treat it properly to get the relief that we're looking for long term.
Okay, there are some good questions people have put in, so let's start with the first one. Any concerns with age, like someone being over 70?
Absolutely not. In fact, on my YouTube channel, Carolyn Harkin, she's an 82-year-old lady who has done my intensive and my advanced classes. So it's not about age, it's about breath. So some people that are in their 30s are older in tissue than people that are older in age. In fact, I find that the youth today, because they have grown up in front of technology and their breathing has been affected, their tissue is literally older than the generation that is older than them because they're so dense. So really, it's all about the education while you're on the block. And as long as you're breathing, you're feeding and healing. And there's nothing aggressive with this work. You are literally lying on the block for a minimum of 3 minutes with your breath moving very, very slowly. So we teach you through the video. If it's too intense for you directly on the floor, you can start on the bed so that there's a little more cushioning. And if that's too intense for you, we give you options how to work until you feel you're capable of getting to the floor. But you know, the majority of people coming to the table to be teachers are over 60 years old. It's very interesting. I'm somewhat shocked at that because I was thinking it would be the younger generation, but it's really not. It's people 50 and up, but we have a lot of women in particular in their 60s that are really being drawn to want to teach this. So no, age is not a factor.
And any contradictions for diabetes or high blood pressure? Also,
no, in fact, this is really helpful because, again, if you think of the pancreas, which lives directly below the diaphragm, and then again the aorta, which comes directly through the diaphragm, when the rib cage is collapsing right on top of the pancreas or the aorta, that is what's causing those issues. So as we're working the breath and we're strengthening the diaphragm and we're lifting that rib cage off of that area, we're actually improving blood and oxygen flow to the heart, to the pancreas, so that we have a lot of people whose issues with diabetes are changing and who have gotten off their meds for high blood pressure.
Now, I know the answer to this one, but I'm going to let you answer it. Is this therapy similar to cranial sacral therapy?
I took level 1 of cranial sacral therapy in the 90s, so I've only taken level 1, but in at least that intro course, it was all about very, very light touch. This is not that at all. You're basically using your body weight and gravity to move really deeply into the tissue to melt through restrictions all the way to the bone. With block therapy, we use wood. So the block buddy is handcrafted from cedar. And it took me 2 years to actually create the proper shape and size so that it naturally fits into the contours of the body, so that we feel supported to get all the way down to the bone where the fascia literally grips and seals, which hold us out of alignment. So I'm sorry, what was your question?
Well, you answered. Cranial sacral therapy is a very, very different thing. I've had cranial sacral therapy done, and this is much more effective than cranial sacral therapy, in my opinion. And,
yeah, no, it's a completely different therapy than cranial sacral therapy. Yeah, and this is a whole body therapy, and we do go very deep. But very deep in a persuasive way, not a forceful way, because again, it's all about melting through frozen tissue. In fact, for anybody that hasn't seen the fuzz speech, that would be something really great to watch. Gil Headley, he shows on cadavers how fuzz literally develops between the interfaces of the fascia, and basically he says the more fuzz, the older the tissue, or the older the tissue. So the goal is that there's no fuzz, and block therapy is highly efficient at melting through the fuzz. So that's FUZZ. So for anybody that just wants to get a little bit more of an understanding of what it looks like on a cadaver, he's done a really good job of translating from a dead body to what an actual live body is going through, although it's different because A dead body isn't what a live body is like. And you're right about the fascia. They actually say that consciousness travels through the fascia system light speed. So it's pretty phenomenal because it moves faster than the nervous system.
Well, it's an analog messaging system, not rather than a digital messaging system, which is what the nervous system is. You partially answered the question. Someone asked if the block is made out of wood and how big it is. And you kind of could see from the pictures, right?
Yeah, there's two sizes. So one is almost the size of a small bread box, and then the how big would it be? Probably not quite the length of my forearm, and I don't actually have the physical dimensions.
I would guess just from seeing it, it's probably 6 or 7 inches long, 5 inches wide, something like that. Yeah.
Something like that. But there's two sizes, and so what's really interesting is we developed the Block Baby for kids. But once we did that, suddenly everybody's using the Block Baby for all these other things. And Stephen, you mentioned that the Block Buddy was too big to take with you. When I travel on the plane, I take my Block Baby. It is incredible to have on the plane or anywhere where you're sitting for a long time. You put it behind your back, you squeeze it between your thighs. There's so many things that we can do with the block to help our tissue, because again, it's all about our body weight and gravity. So sitting on the block, you don't have to take time out of your day to do block therapy. It's really about integrating block therapy into what you're already doing in your day.
Yeah. Now, this is a really good question. Someone asked, how would this help a knee injury? Partial tear of the ligament. How would?
Oh, awesome question. So ultimately, we need to have optimal blood and oxygen flow to repair tissue. And if there's a knee injury, it's not just about the knee, it's about the pelvic alignment. So when we're doing block therapy and we're releasing the fascia through the whole body, the pelvis, we're actually releasing the block in the femoral artery that's blocking blood and oxygen flow. And I actually, if you go to my YouTube video and you see acute injury healing, I've done some phenomenal things with fractures, where fracture healing's in days. And that's because I don't believe in the blocking blood and oxygen flow when there's inflammation, because ultimately the second law of thermodynamics is nature abhors a gradient. So when there's a gap in the system, nature's going to fill that in. So if we have a break in a bone, a tear in a ligament or tendon, the body in its design sends oxygen, nutrients, minerals, whatever that tissue that's been damaged, it's sent in the inflammation to be repaired. What we need to do is we need to assist that inflammation through heating. We don't want to stop that inflammation, which is what we've actually been trained to do. As an athletic therapist, I was trained to apply ice and pressure to stop inflammation, but that gap is still there. So what ends up happening is the body fills that gap in with scar tissue, with the netting, the fascia, but not live fascia. It sucks in the fascia, creating a block to blood and oxygen flow, and that basically alters the entire system. What we really want to do is we want to feed that injury. So I love using the analogy, if we were baking a cake and we put in eggs and flour and butter and milk and whatever to create batter, it's only batter until you cook it. Once you cook it, now you have cake. So when the body is sending inflammation, it's sending all these nutrients, all these things that tissue needs to rebuild, but we need to heat it in order to actually cook those nutrients and to rebuild the tissue so that it's healthy again. So it's pretty amazing when you do block therapy through the whole body and you're learning how to oxygenate your system more effectively, your body heals at a much faster rate. Plus, it's also about postural education. So one of the reasons we develop injury is because we're not aligned. So our system is under pressure all the time, which creates issues and problems and stresses. So wherever there's a high amount of stress is an area where tissue can rip and tear more easily. So when we're properly aligned and everything is balanced and symmetrical, there's far more integrity to the tendons and ligaments and muscles, so that there's less potential for injury.
Actually, I make a little even more accurate explanation of what happens at a site of injury, because you know a little bit about pH, right? But pH actually is not only the potential of hydrogen, but it's also a potential for holding an electrical charge. So an alkaline pH holds extra electrons to deliver energy, and an acid pH is actually missing electrons, which means it's sucking up energy. Well, your normal pH around 7.4 is, I think, 20 milliamps or something. But when you get an inflammatory process, that heating is also an electrical heating. The pH goes even higher to where you have a 50 milliamp current that actually is driving energy to promote healing into that area.
Awesome.
Yeah. This is another question. Have you had any success with scoliosis?
Oh, yes, love it. If you go to my YouTube channel and you see Christopher's journey, this was the first young man that I worked with really severe scoliosis. He came to me when he was 17 years old, and they told him he wouldn't live past 21. And when you see his before picture, it's really frightening how twisted he was. He wasn't getting any, like there was so much compression on his stomach he couldn't eat. And he was so skinny and frail. It was really sad, and he's thriving now. So since then, I've actually worked on many people with scoliosis because they've seen his video and they've come to me. And yes, it's incredible because really it's all about creating that space in the core to release the tension that's pulling the spine out of alignment. So it is really effective for scoliosis. So that's, yeah, Christopher's journey on my YouTube channel. You can see what's happened with him.
Great. Someone just asked if there are any pictures with it. I guess they must have missed the first part of the webinar. And this is not similar to Calinetics either, right? You feel
No.
like, no, very, very, very different. This is Deanna's own work. I've never seen anything like it from anybody else. How about degenerative disc disease with arthritis? Have you ever worked with that?
Yes, with a lot of that. And again, the reason this is so beneficial is because for people that have degenerative discs, it's because of the collapse in the front of the body. So again, people typically have pain in the back. And, you know, the discs will shoot out the back. They'll become herniated. They'll put pressure on the nerves. What we need to do is we need to address where the pressure is, the compression, which is in the front. So absolutely, we have had tons of people with that issue that have had huge improvement. And then arthritis anywhere in the body, because really, if we're talking about osteoarthritis, it's a wearing of the cartilage, which occurs from a mechanical stress. So that mechanical stress happens when the joints aren't properly aligned, which when we collapse, and again, that 2,000 pound per square inch fascia holding our body out of alignment, that's something that people don't understand how to release and how to change. With block therapy, we're creating that release, and then again with that postural education, we're creating a moving the body back to its proper alignment. So we put the space back into the joints so that we stop that mechanical wear and tear, which stops that inflammation from happening. And then the body actually just improves in its blood flow and starts to rebuild cartilage. I, in fact, had somebody that was scheduled for a knee replacement who never ended up having one because he did the work with me.
Would you make sure that you email me your the URL for your YouTube channel? I'll put it up on the page with the class handouts and recordings, and make sure that people get that information when I send out a follow-up email, because someone just asked you, just what is, you can tell us right now the name of your YouTube channel, but I just want to make sure we get that to everybody so they can see the
block therapy, or sorry, what is it, Quinn? Block therapy, whole healing for body, mind, and spirit is the URL for the YouTube channel. Now, if you go onto my website, fluidisometrics.com, we have the YouTube picture you can just click on, and you'll get right to my Fluid Isometrics YouTube channel.
Someone else asked, is this safe for someone with DDD of the cervical spine? I'm not sure even what that is. It said they've got DDD of the cervical spine, and I'm not sure what that is.
I'm not sure what that is either.
Yeah, I've never heard of DDD of the cervical spine. Does this take the place of chiropractic care?
This is completely different. So, you know, this is a complement to whatever people are doing. And what's really great is it's a complement to the chiropractics, because if we're adjusting the spine to put it back into proper alignment, if we don't address the fascia, which is holding the spine out of alignment, those adjustments aren't going to last. Where if you do it in conjunction with those chiropractic adjustments, then it holds. Many people have found that, you know, because it holds, you don't have to go back for repetitive adjustments.
Yeah, that's been my experience. It's actually made the chiropractic care I get, or well, I'm not talking about block therapy, but the other stuff I learned from you previously, before this, has made me chiropractic adjustments hold better, and me actually need less chiropractic care than I used to in the past.
Oh, Stephen, so DBD is degenerative disc disease.
Degenerative disc disease. Yeah, we had addressed that previously.
Yes, we did. Again, with the cervical alignment, like one of the things that we deal with in the neck is also strengthening the tongue muscle to help support proper alignment of the neck. And that is really key, because if we look at the average posture, the head falls forward, causing the discs to wear when we're moving our head. But once we release that fascia and then we start to strengthen the tongue muscle and properly align the head and the neck, now we don't have that wearing again of the cervical, of the vertebrae. So the inflammation, again, it doesn't happen when there's no excessive wear and tear. So absolutely that helps with degenerative disc disease.
Someone said in the 21-day video class, is that really enough for someone to learn the techniques without going to a live class? Sometimes learning on a video leaves me wondering if I am doing it correctly. By the way, I found, just before you answer that, I haven't watched the videos yet. I just have the little guide to the 21-day program. I found it really easy just to follow what to do from just reading and the pictures you have. The pictures were really clear. It was really easy.
Yeah,
it's not like trying to do yoga.
No, it's not like that. And I do recommend that before people jump into the 21-day program, they at least do the first video on the DVD, the core video, because in that I instruct on the proper breathing, and that's the key. We want to make sure that as we're in the position, we're optimizing our breathing, and we focus on the exhalation phase. So the breathing mechanics really is the key to the success of doing block therapy properly. And I feel that on that DVD, I have instructed it very well, and it's very simple. And again, the nice thing is you're not doing anything fast or aggressive. So it's really all about you settling into the position and you just listening to the breath and following the pain. And it's really simple. And it's, you know, when I say following the pain, that sometimes scares people, but the really cool thing is pressure overrides pain. The pressure fibers are larger in diameter than the pain fibers. So when people are on the block for 30 seconds a minute, suddenly those pressure fibers kick in and that pain changes and it feels like a good pain. People become addicted to that pain because it connects to that meditative quality. Block therapy is an exercise, meditation, and therapy all wrapped up into one very simple to do process. It is so simple that people don't actually believe that it can do all of this. So with the video and the 21-day block blitz, I do believe that there is no question that people will have the proper instruction, but also that's why we have also included a consultation with our block therapist after one round. If there's any questions or any issues, then we connect you with our block therapist to make sure that your needs are being met.
I noticed that when I was lying on my belly on the block and doing the breathing, that you kind of just relaxed into it. And then at a certain point, it was like my body said, okay, that's enough for today. But it really did. It was very easy to do. And I'm looking forward to getting back into it this coming week, because I also noticed when I did it on the pubic bone, it really helped the prostate area to feel better too. Which is
absolutely. And what's so great about it is you do it in bed. Like I do it while I'm watching a movie. You hang out on the block. It's the easiest thing to do. So that's what people love about it, is you don't have to work up a sweat. You don't have to leave your home. You don't have to go outside. You don't even have to be upright. You're literally lying on this block, letting your body weight and gravity do the work with the block. So initially, you just want to pay attention to the instruction because you want to learn how to breathe properly with this to optimize the results. Once you know that and that becomes your habit, Then you hang out on the block. I'll put a 2-hour movie on, and I'll just be lying on the block while I'm watching a movie and I'm being entertained. So it's really awesome. And I'll take it to bed with me, and I'll wake up with it. I'll put it under my rib cage as I'm falling asleep. It is so soothing. Wood and bone communicate beautifully together, and it is a very soothing, wonderful experience. Even if people are in significant pain, you know, it's the connecting to the pain with the pressure with the block that really calms the pain sensation down. And again, people are in control. You know, if you're on the floor and you're like, wow, that's just way too much for me, then you do it on your bed. And if that's way too much, then you start with a rolled up towel, or you start with something different, but you're instructed on that through the DVD so that people are safe. And we're always here. You know, if anybody has any questions, they have any struggles with anything, info at Fluid Isometrics. You can get in touch with us anytime, because we want to be here for you and make sure that your experience is really awesome with us.
Someone asked about doing this if you've had a stroke.
Yeah, we've had lots of people do that. And again, you're awakening areas of the body that have been blocked from life, which have become paralyzed. Now you're going to melt through those restrictions and those blocks to reoxygenate, revitalize tissue that hasn't been used. Really, really helpful and beneficial. When we start connecting to that diaphragmatic breath and we start feeding the body, again, up to 600% more oxygen, everything changes.
Two monetary questions. Someone asked, do you have a payment plan?
We don't have a payment plan for the 21-day program, which is $247, but we do have payment plans for the Block Therapy Whole Health program, which are more involved and more expensive. There's a two-pay and a three-pay payment plan.
Okay. And then someone wants to know the cost of the year-long program.
It is $49.97 for the full year. And again, you have a private health coach with you through that whole year, as well as 26 lessons from me, the Master Your Health program, which really was my teacher training program. But then because all of this amazing information was delivered to the teachers, I thought, you know, this is really what everybody needs. For me, if people understand why they're doing what they're doing, it's way easier to do it. So that's why I included the Master Your Health program with this program, as well as the 21-day program. So $49.97 for the full year, and you can get phase 1, which is 3 months long, for $2,500.
Okay, and then of course you can get the videos and the instruction manual and the block for the $247. Okay,
yeah.
That's all the questions we have. Thank you for sharing your information with us this evening, and thanks to everyone who joined us and for all your great questions, and hope that you we kind of got you interested in the whole idea of working on the tissues and the effect that that can have on your health. So thanks.
And thank you so much, Stephen, for opening us up to your people and giving us the opportunity to share this work. I'm really grateful and excited to be delivering this message to lots of people.
Yep. All right. Good night.
Good night.